p.m. on this, the 13th day of January 2022, and I call this emergency meeting of the United Independent School District Board of Trustees to order. If I can have the board members that are here present, the board member recite their full name for the record.
Ricardo Rick Rodriguez, present.
Elisa Flores Oliveros, present.
Javier Montemayor, present.
Ricardo Molina.
And myself, Ramiro Vélez, the third present, and we have Mr. Juan Ramirez logged in, and Mr. Frank Castillo.
Oh, Mr. Castillo too.
Mr. Castillo, yes, sir.
Frank Castillo present.
All right, let the record show that a quorum of board members is present in person and through virtual means, that this emergency meeting has been duly called, and that notice of this emergency meeting has been posted in accordance with the Texas Open Meetings Act. First agenda item, we're going to do a Pledge of Allegiance and Texas Pledge here. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor to Texas flag, I pledge allegiance to thee, Texas, one state under God, indivisible. Thank you. Agenda item 4, any public comments signed up, Mr. Gonzalez?
Chevelli's not at this time.
Not at this time, okay. So we'll move on to agenda item 5, informational items. Item A is information regarding an update on student and staff COVID-19 intake reports.
Yes, sir. At this time, we're going to have staff present that, and they'll be tagged along with B, information also regarding on the remote conferencing.
Yes, sir.
We'll have Gloria Rondon, David Garcia, and Malesa be presenting.
Thank you.
You have the PowerPoint, please?
Good afternoon, members of the board, members of the Mr. Castillo and Mr. Ramirez who are online, and members of the audience. We wanted to share some information with you with regards to student intakes and student absences for this particular week. If you can move on to the slide, please. Monday, we started reviewing our attendance numbers, and we had a 78.7% attendance rate. And so there's the first row there that you see is the actual absences for students. And so yesterday, it was at 8,308. Today, we had a little downfall on our system, with campuses reporting, about half of our campuses reporting. Right now, we have about 70% attendance today. So it's only half of them that have reported, because high schools are probably still inputting some of the information. But this is the trend that we had been seeing throughout the week. With reference to intakes, I will have to tell you that we started our intake process on Friday when we returned back to work. Our next slide, please. And actually, that's Mr. G. I don't know where the other slide went. That one. There you go. So we started inputting our student intakes, and what we mean by student intakes is anybody who was a positive, who was exposed to a positive individual. These are students. And so on Monday, we had some issues on Friday. We tried to address them Friday, Monday, Saturday, and Sunday. We only had 31 student intakes within the system, all right? As of yesterday, we had 1,413. I did make contact with the City of Laredo Health Department just to advise them that our system, we were having some problems with it. It kept crashing. There was too much overload in the system. And we are still behind in inputting now. So I would venture to say that, I mean, I had one campus tell me that they were behind about 200 intakes to input. And that was just one high school campus. So we're looking probably at about another 1,000 that have not been inputted on the positive individuals. And of course, these are daily. The system is currently working right now, but it's just the life at the campus continues.
Right.
And with students going into the clinics, and our nurses are the ones who were usually inputting. So we did have a change of process. We're asking our parents to assist with the inputting, because we do not have the manpower at the campus level to continue that process. And so this is why we had some glitches here.
All right, on the input numbers, these are also, you're factoring in the student staff that we're testing on the individual campuses?
Yes, sir.
Yes.
Okay.
Yes, sir.
And we're
But-
doing testing throughout the district. At every campus, there's available
There is a limited available, sir.
Limited available.
It's the individuals who are showing symptoms on campus. But we've had parents who are coming in from the outside in the public wanting us to test. At that point, we are saying we're not a testing site. We do not test.
Are we
communi-
strictly focusing on employees?
And students.
Students that
Students who are
has-
symptomatic.
Correct, okay.
Mr. Gonzalez, how does this work? Does the state, do we have anything, any coaching with the state? You know, what's happening with all these people, like employees and students missing? and all
Right
that?
now, we're going to jump in this afternoon with a meeting with the commissioner. As of right now, we also talked to Jeff Curtel from TEA. As of right now, no, I know they're looking at, it's been talked about reviewing our attendance AD the first 6 weeks. That is something that's being considered at the state level right now, but is there anything official? No, sir.
So
just-
I have a question.
Just to add, though, for those absences of this week, there are low attendance day waivers that we can submit for this particular week. The system is closed right now at TEA, but there is some guidance that TEA is sharing with us as well. Yes, sir.
So on these intake reports that y'all have, those are forms that y'all have, y'all used to have at the campus, and now that they've gone online and you're asking the parents to do that. Is there any way to streamline that form?
We have,
Make it a little easier? But how many pages do y'all have there?
It's 3 top, sir. It's the student's name, grade level, the campus that they attend to. We ask for an email address for the parent. It's very, very simple, sir.
Okay.
To complete.
We're talking about maybe 3, 4 questions and,
Maybe a little bit more, sir, because we have to make sure that it's the right student. Because I may have a lot of Juan Ramirez's in our school system.
Okay.
So I have to pair.
Identify them.
Exactly, sir.
Just also to add, we've just created 2 videos, one in English, one in Spanish, posted them on the website so that we can also guide parents through the processes that they need to, the forms that they need to fill out.
and once the parents get this form and fill it out, who at the campuses do they need to contact to make sure that their concern has been addressed, that they're have been approved for remote conferencing?
It's not necessarily at the campus. I mean, it used to be the nurse, sir, but the nurses,
Yeah.
we're not reaching, we're behind.
Yeah.
About
I know
4
we have some principals.
4 days behind or so.
We have some administrators and principals who are actually dealing with those intakes themselves.
Yes, sir.
And so that,
All hands on deck right
yeah.
now. Yes, sir.
Yes, sir.
So it's.
So there's a lot of moving parts and new individuals who are probably getting their hands into the system. But the reports have been streamlined. It's a 3-step process. If you complete the intake, then you complete the remote conferencing intake, then they get the link automatically sent to them by CNI. It's taking a little longer to get the link. Some parents, are asking for them. I haven't gotten it. We're behind. I will be upfront with you all. We're trying to catch up, trying to meet and provide the services for our students, but our staff is behind with limited 65-70% staff members on campus.
That number, the 1413, is that what we're behind, or that's the total
That's what we
intakes
have.
for the week?
That's for today, sir. That's we went from Monday, 31 student intakes,
To
to 1413 yesterday, and that is climbing.
All right, so 1413, but we're missing about 7,000 to 8,000 students on the attendance side. So obviously, we're stressing parents and staff to try to see if that number is going to be the amount of
More
students that
than-
are actually out because of,
Probably not, sir, because a
Probably
lot
not,
of
right.
parents just are not sending, they do not meet the 3-step criteria, which is COVID positive, COVID exposure, or temporary medical disability. They're just simply choosing not to send their children to school for safety reasons.
and we can't proceed to actually offering the remote instruction without going through the intake process, verifying that they are
Correct.
meeting one of
Yes,
the
sir.
criteria that's going to allow the state to be able to
Correct.
count the minutes and count the remote instruction. Is that correct?
Correct,
Correct, sir, yes.
All right.
right.
So I think that's the thing that we have to stress, that for us, we are obviously encouraging the intake process, we're encouraging feedback from the parents, we're trying to do as best as possible. I know the employees have been going way beyond their duties, and we're really appreciative of that. But we're trying to get as many students with this process to be done, to be able to get them into remote instruction and not lose any time. And then, again, what is the amount of remote instruction that the state is allowing once that exception is met?
If it's remote conferencing, which is for the temporary medical
With the temporary
condition,
one.
we do not have a limit on that.
Okay.
Okay.
So So they
But
can-
they do have to meet the 3 criteria.
Yes. Okay, so,
Mr. Gonzalez, I had a question.
Mr. Castillo, go ahead.
I wanted to know, do we have a different, for each school, do we have different staff doing the inputting? Is it just one individual?
It's different
per
staff, sir. We have
Or
a-
several?
It's
How
sev-
many inputting stations do you have?
Sir, we have asked principals to designate other staff members. However, I will tell you that there's sometimes a pause when we have to receive bus students, when we have cafeteria duties, when we are scattering ourselves to cover classes and substitutes. Our staff is being stretched thin in all areas, and this is why we are behind. There is no designated individual right now,
varies.
sir, because it fluctuates on a daily basis on an outcome. I may have a teacher who's feeling sick, and that individual who was maybe inputting has to go cover that class. And so it's moving constantly, sir.
I think we recognize that the staff is working very hard. I think this is a very tough time for administration, for all the campuses. The reason I asked that question on the intake system is because I want to make sure that the community and the parents know where to go, they know what they need to do, and so it can try to work smoothly. But it's an imperfect system because it's all moving parts out at one time. So I want to make sure that the staff recognizes that at the board level, and I think I can speak from everybody here, that we're very appreciative of the hard work that they're doing right now.
Sir, we appreciate those comments because I know in our principals' meetings, Ms. Lesas here also, our principals probably have felt the work more than any time probably in their career because this week has been giving them the biggest opportunity for growth because we are really stretching them to the brim, our teachers as well. So thank you for those comments to recognize our employees.
Yeah, I think you said it's all hands on deck. You know, this
All
is
hands on deck.
a crisis situation. Something we've never been through in the past, and we just went virtual, and now we're sort of hybrid, I guess you would say. I have received calls from the community, from both sides, you know, saying, we need to be safe and go virtual, and then I've had others call and say, this virus isn't going anywhere, we need to keep going. But at the end of the day, it's what are we doing with our staff? They're burdened, they're tired. And that's when things happen. That's when safety becomes a major issue, when you have overworked staff that are stretched in all areas, when you have students in a classroom without a teacher, and we're scrambling, trying to get an adult in there to supervise these children. And that's where you have to weigh both sides, and you have to make a decision. And I think you'll give us more information on that in just a bit. But yes, we're very appreciative of our staff and our students and our parents.
We're going to continue the presentation. Go ahead.
Yes.
Okay, the previous slide, please, on employee absences.
To my question, I wanted to find out if there's a requirement by the state that the person inputting has to have some kind of certification, or is it just at large, anybody can do it?
Anybody, sir, anybody.
Just for my sake to understand the process.
So this is David Garcia from Human Resources. There is no certification required of the individual inputting the information. The forms are simple, and what they do is they just ask for certain key information. Earlier, Mr. Montemayor asked about streamlining, which we have, but one of the key things that we tie into our reports is the fact that the information goes to the health department. There is tracking as to how did the person get infected or get that virus, and that tracking is something that we have to do. So those questions have to be asked in order to get to that information. Can you go to the previous slide, please? There we go. Employee absence. There we go. If you look at Monday through Thursday of this week, as I speak to you, from the time we generate these numbers, they've already changed, and it's constant. And what's happening right now, we have staff out of HR that work with intakes, and they're received in our department. They worked on weekends. They worked late at night. We've had individuals that needed to be out for COVID-related matters, and we are behind. So as a result of that, what we've done is we ask principals to make spot decisions regarding the protocols, follow them instead of waiting for human resources in order to determine whether an individual stays out due to test results or very simply a person is allowed to return to work in order to care for the student. students that are attending our schools. If you notice that they are progressively higher on the district-wide from Monday through Thursday, from 9:09 to 10:14. At campuses, you see the breakdown, and up to 6:06. And then you look at teacher absences today, 549, and those without subs, 266. And what's happening, we have a complement of over 700 subs, and they're just simply for different reasons, either not answering or not taking jobs for fear of exposure or different reasons that causes them, one, to care for children that they're keeping at home. So there's a multitude of reasons where we arrive at these numbers. From August to the present, we've had 1,355 intakes from an employment side. Of those 1,355, 755 have tested positive, but a good number of those have been able to return to work. In this particular slide, you have employee intakes, and you look at this from the 14th through the 11th, and you're looking at 986 intakes, and of those have a positive status, and you see the further breakdown of additional information as to how they were exposed or to a family member or confirmed students or those that have symptoms. And of course, please know that the volume of intakes, we're still working on processing them at this time because we are behind, no doubt about that.
I'd like to interject in Mr. Garcia's previous slide, where he mentioned about teachers without subs, there's 266. But I want to make it very clear, we are addressing those needs of our kids through other staff members within the district and obviously within the campus. Our campus principals have been obviously on top of it, and we've been working collaboratively with them. We are addressing them. We're not leaving classrooms by themselves or kids by themselves. Okay?
And Mr. Gonzalez, thank you for that clarification, but, I mean, everybody can see the numbers are just increasing.
Yes, ma'am.
And at the end of the day, they're going to be even higher than what we're looking at
Yes.
right now. So I go back to my comments that I made earlier. We're doing our best. We're stressed. And everybody knows that when you're stressed, that's when things
Yes, ma'am.
happen. So any decision we make today is going to be based on safety. We all agree, students need to be in-person instruction in a classroom to learn properly for good student instruction. But at the same time, you have to look at these numbers. They cannot be ignored. They're screaming at us, and they're shouting all these alarms and saying, do something before something happens. So that is my concern right there. It's only going to get worse. I think we just need to buy some time is what we
Yes,
need to
ma'am.
do. We're doing the best we can, but how much more can we do in the name of safety?
Right, okay, so let's talk options then.
Sure.
I'm not,
I don't know.
there's no voting item
Right.
right now, but I think we've looked at the different options. So obviously, option one would be to completely shut down the district and go virtual, which we've done in the past. I think the issue that arises that we have to mention is that there's obviously no support from the state for that option, as far as to completely shut down the whole district and have the minutes, the instructional minutes counted. The only exception right now would be if students are meeting certain criteria. So what happens if we still go that option? What does it put us with the state as far as on the instructional side? On the
Reimbursement.
meeting, reimbursement, I think the funding, I think is something that we can definitely deal with, but more so on the instructional minutes as far as, we definitely have to make updates at some point. That, and we're getting, I think, to the point that there's really no time in the future to make updates without either going into spring break days or
Summer.
in the summer.
Summer.
We can't even add at the end of the calendar year because we have
Graduation.
college classes, graduation starting right after we close the end of the school. So I think what options have you guys considered as far as if we should completely shut down?
Mr. Velez, if I may, I'm going to graciously ask, with all due respect, if we can go through the PowerPoint and then we cover this area.
Definitely.
So
Oh, sure,
Ms. Lessa can cover the details that directly impact the points you're bringing
I
up.
think there's information throughout the
Yes.
presentation
Correct.
that are gonna.
Thank you.
Thank you, Mr. Garcia.
Thank you, Mr. Garcia. Thank you. Good afternoon, board members, Mr. Gonzalez, and members of the audience. What we do have is we've been, again, taking the intakes on the remote conferencing for those students that do meet that 3 criteria from the state. And if you'll notice here, I'm just giving you a 2-day comparison. From yesterday to today, we had an intake increase of 544 students. Now, when we left for the break in December, we had about 200 students district-wide in remote conferencing. When you see that now compared to 4,292, we're adding about 4,000 more students to the remote conferencing. So that means that we will need to make some adjustments to how we had it, because we were working it district-wide. We had designated teachers district-wide to handle that influx. Again, this is temporary, so as we would get more students in, we would have students go back to the classroom, so it fluctuates tremendously. This is always a very fluid number. But given the fact that now the parents, because of either they're positive or because they do meet the exposure criteria, the parents are submitting these forms. Now, what we also did, working with Ms. Rendon, is we've put everything together, so when they do the remote conferencing, they'll have the link for the intake. Again, helping our parents to take care of everything in one, kind of like a one-stop shopping place. And then also, we've provided videos guiding them to complete all of this information. But I do want to say that the dramatic increase in numbers here will dictate to us that we need to make some changes to the way we had it. We cannot have like one remote conferencing teacher that had 50 students now have 175. That's just not conducive to learning for our students, and we know that. We can go to the next slide. So we are planning, we're using this next week to plan. We are going to have remote schedules now mimic our daily schedules for every campus. The high school right now runs remote conferencing at every high school individually. They have their plan. We're going to continue with that. At the middle school, we are going to pair schools that have a Pathfinder with schools that do not. And our Pathfinders have 2 conference periods, one to plan and the other one to do the pull-out for student instruction. We are going to now take that one additional conference period so that they can provide the remote instruction, because we will have to increase the number of teachers doing it. At the elementary, you'll notice in our chart that the elementary has the largest numbers, and we understand because of the age group. So we're going to have a system for every elementary campus to have a pull-out so that the teacher can just do the minimum number of time per grade level, and then the teacher will go back. So we will not, campuses will not lose teachers. They can rotate their teachers to do the pull-out instruction, and then they'll have their own students to be able to monitor and bring back into the classrooms. So that's what we're planning. We're planning to hold these meetings with principals to iron out every detail to make sure that we've got this system in place.
It's a moving,
Yes.
it's moving all the time.
Yes, and we were doing fine, and it was always a moving target. It was. We had over 2,500 applicants in the fall semester, but they were, as students were going back, we had new, and it was manageable. We were able to take care of that influx. At this point, with over 4,000 more students, we will not be able to run it the way we have been running it district-wide.
With that having been said, and you keep saying it's a fluctuating number, so when a student meets the criteria for remote learning, if they've been exposed or they're COVID positive, how long are they able to continue?
It's a 10-day period,
Okay.
and every student is granted by the state a maximum of 20 days. So for example, if they were exposed once and then positive, they'd have a maximum of 20 days. In the students that have a temporary medical disability, we're able to submit waivers and extend that 20 days if the state approves them, and we have been doing that.
Yeah, that's since the very beginning, I
Yes.
remember, since the fall.
Yes.
So now that we know that, do you foresee that in a time frame of 2 weeks, these numbers will drop dramatically?
I'm going to say these numbers will drop, but I don't know if there'll be additional that we will have, again,
Okay.
because it depends on positive and exposure.
Exposure.
Depends on the surges also. You know,
Yes.
festivities are coming up for WBCA,
Yeah.
spring break. Will we ever get all these students back at one time is also, a concern. Because, as you say, they're fluctuating in and out,
Yes.
depending on the
It's,
surges.
yeah, it's very fluid, and as we're getting students back, we're putting students on remote conferencing, and,
We're already down on student enrollment. I'm concerned that we may never get these students 100% back because of the fluctuations and surges. And so, my question is COVID considered a temporary medical condition?
Yes, it is. Those are the three criteria that the state gave us. COVID, this is for a temporary medical condition, and in that branch,
Right.
they said any communicable disease such as COVID,
COVID.
exposure to COVID, and then, for example, if a student were to break a leg, let's just say, and they can't be mobile for 10, 20 days, then they can also go through the temporary medical disability, yes.
That's up to 20 days, so there's a lot of students who, or a lot of people who don't test negative after the test, after the first 10 days. Are you requiring to come back to campuses? Is it a negative PCR test?
We're following the same
Okay.
protocol that we have from CDC right now. Mhm. That's all the information that I have on.
Thank you, Ms. Reyes.
Thank
I don't
you.
know if you have any questions.
Well, I mean, I do. I'm struggling with asking it, but
Do it.
with the numbers the way they are right now, do you think that we can sustain ourselves the way we are, kind of hybrid, with the amount of employees being out in a safe manner?
I think the biggest concern that we have is the staff. I will tell you, in our department, curriculum and instruction, we have put everyone that's able to on campuses. I'll tell you that Monday, I had 5% of the staff out at CNI. Yesterday, it was 13%. And in one department, there was 8 people that either tested positive or had children that tested positive. And that is what we're dealing with. We've met with principals, and that is what principals are dealing with also. Either their staff is positive, or the staff's children have tested positive, and so they need to be at home with their children who are ill. So that is our biggest concern right now, the adults.
So if the numbers continue to increase the way the trend is showing, and we continue to lose staff, we may get to the point where we may not have enough staff to cover the education.
That's what we're trying to forecast right now, yes, sir.
I see.
Is what has mean information before we make any kind of decisions.
Yeah, because we're going to have to make a decision based on unknowns, and it's hard. And I want the public to know that it's a difficult decision to make, because like I said earlier, you're getting calls, on both sides. But at the end of the day, our decision, I can speak for the board, I'm sure, is going to be based on safety. So it's
Thank you.
difficult. It is very difficult.
All right, so we got information that those A and B on agenda item 5, we have for the intake reports, the remote conferencing process, where we're at there, and some of the guidance that we're getting from the state. We'll move on to agenda item 6, that's items for individual consideration. Item A, discussion and possible action regarding the resolution of the board for extension of district-provided emergency paid sick leave for eligible district employees. So this is something that ties back into obviously the situation that we're
Yes, sir.
experiencing.
Mr. Feliz, members of the board, members of the listening audience, and those present, would like to come before the board and make the following recommendation for resolution. What have happened in the past is the district initially worked with a federal mandate back in April of 2020, and of course, they afforded us for individuals to be out for 10 days, and of course, we would pay those days under federal guidelines, and of course, it would be for those who tested positive and those who had to do with exposure and so on. We've extended it twice after that with the appreciation from the board in allowing individuals to qualify. We're coming before the board to present this resolution for extension of the resolution itself to give employees an opportunity who unfortunately test positive and are vaccinated to qualify for an additional 10 days of leave. And I know that if you don't work, we work to put food on the table. We understand that.
Right.
And of course, what we're doing with this recommendation and extension is to extend it, but retro to January 1, go full cycle for 12 months, and end on December 31st of 2022. What happens is the entitlement of the 10 days still remains constant. It doesn't change. So if during this leave period, during this the EPSL extension, if the board approves it, if an individual tests positive, they use the entitlement of 10 days, and it comes to them. But during that 12-month window, if they test positive again, they would have used up their 10 days, and there's no additional days of entitlement after that. So it is that window of time, and unfortunately, there are different factors, circumstances that cause for an individual to be exposed, whether it be attending a social function or family member, whatever the case may be. But it is something that the administration is recommending. We've met with the superintendent of schools and his administrative team, and of course, we are making this recommendation before the board in order for you to consider.
In other
this
words, if
particular-
you test positive one time, you can't afford to get positive again.
Right.
Otherwise,
Yeah,
you lose all your privileges.
Actually, it's a benefit, it's an extended benefit. Fortunately, in public schools, employees have an opportunity to accrue leave days so there can be income. So we do encourage employees to carefully use their personal sick days,
Well,
and of course.
Let me ask you something.
Yes, sir.
Let's say for whatever reasons, you get sick with COVID from a family member. Okay, you get your 10 days, then you're clear, you're clean back, and you go to work, and you catch it from a student or from another employee, and you test positive again, who do you blame?
There is no other 10-day entitlement, it's only one time.
Why can't they? Well, what do you do with that employee?
That employee will stay home, and hopefully,
No pay?
Unless they have
that they
time.
have accrued leave days, that there can be income.
So there's an
If-
additional 10 days to what they already have given us by the state.
That is correct.
Yeah, but I think Mr. Rodriguez is saying, and I know people who tested positive 3 times.
Right.
I think what Mr. Rodriguez is saying is that sometimes you don't know where you got infected. And if an employee got infected because they're working for us, is that what you're saying? Then I think it's only right that we extend this to them for the second time. Are we able to change that and take
We can.
away that?
We are.
That as long as they test positive, they can have this and they're vaccinated
I
and they
think
meet the criteria?
the criteria that we have is they test positive and that they've been vaccinated. That's the other
Yes.
two.
That's correct.
That's the other.
That's the only way, I guess.
So you want to take
I want
away the
for them to-
limit of only one time?
Yes, and if they're vaccinated, I would like for them to get the privilege. I mean, they're trying
They're
their
trying.
best right now, and we just gave them compliments, and at the same time, you're trying to kick them, because, you know, if they get sick for coming to work, you know, you're putting them out there, it's like, you know, you can't come back to work. And if they lost their time for whatever reasons, that's kind of hard, but they did take the precautions of getting vaccinated with their 2 shots and their booster shot, so I think they deserve it.
I don't disagree with Mr. Rodriguez, but, for example, a lot of people tested positive on the Friday when you tested employees. They didn't catch the COVID. They were already positive when you had that Friday test.
Yeah, they got
So
the Christmas
they
holidays.
caught it while they were probably off on a
Yes, sir.
holiday or traveling or doing other things. So, you know, I think that's also something that, you know, who's going to decide, did you catch it at work, or we're just going to give it a blanket?
I say give it a blanket.
A
I would
blanket-
give it a
I
blanket.
would.
a blanket,
There won't be any type of
coverage.
discrimination.
I mean, because you have to
Having to prove
live
it.
your life, and if you've gotten your booster, your 3 shot, what more can you do to protect yourself? You wear your mask, but you still have to live.
I'd just like to share that, you know, that the employees are given days by the state that they can take up to 10 days, and then there's additional days. We've extended it. This would be, I believe, the 4th time we're extending this. There are not a lot of districts in the state that actually do this. Then I'm just giving you the information, okay? We are doing an
And
extension
this
for
is,
employees.
again, just for the record, Jaime Garcia, legal counsel. This is entirely district-provided EPSL, so you are able to set the parameters as you see fit. Currently, as Mr. Gonzalez mentioned, this is an extension of a previous resolution that extended for eligible full-time employees, those being vaccinated, the 10 days of district-provided EPSL in the fall semester. So even if they use their allotment in the fall semester, for example, if they reinfected in this spring, they would have an entirely new allotment of,
Yeah.
correct,
But within a 12-month.
within the 12-month
They can
period.
only use it once.
As the way the resolution is being presented as, on screen, yes, but it is the board's decision if they want to modify any
Well, what
portion.
if we say if they have a booster, if they have the 3 shots, then they can
Yeah,
use it
and
again?
just to give you a little heads up, you know, right now, we're going through a situation, and it's very hard. We experienced it because of all the holidays, and spring break is coming along. We're gonna be in this situation again in spring break. I mean, so somebody's bound to get infected again. So So it's gonna affect another employee sooner or later, or several employees again. And apparently it's gonna be, we're probably gonna be with the same numbers, or maybe even worse. It all depends, because we're still not over this dilemma. Winter's coming along, so the flu and all of that's gonna play big factors, and a lot of stuff that we need to do. So I think the wearing the mask, which I know we can't enforce it, but maybe taking a little bit more precautions. I know that we're still checking backpacks coming into the schools. I think maybe avoid right now backpacks and not let anybody, kids, carry their backpacks, but be retesting them again. I know that right now with some of the vaccines, you show no symptoms. But at least we're taking those precautions so the public would know that we're taking precautions and checking temperatures and for them to wash their hands and to be on top of the kids. I know that we're also short in staff to be doing that, but those would be precautions that we could start taking and be ready also for spring break, because we're gonna see this again. So that's the only reason why I don't agree only on 10 days for the whole year, because we're gonna be facing this again in spring break.
And just if I can, just a few comments here. Board Member Rodriguez, administration is gonna go with the recommendation what you approve. We're gonna go with what you approve. But just to make it very clear, we set the 10 days and we set parameters. And one of the objectives is obviously we're looking after our employees. You know, we're adding more 10 days, we're adding more 10 days than the state gives them. The other one is set parameters to encourage our employees to get vaccinated, which we cannot enforce, but it encourages them. And I think the last one also is we're giving another 10 days. If we keep adding, it also gets a set frame of mind for employees to be a little more careful because they don't have a lot of days. I'm just putting it out there as a precautionary measure to let our employees know we're doing this for you, but at the same time, we ask you to be responsible because it's not a free-for-all. We're doing this additionally from what the state is giving you. I just wanted to make those comments. Thank you.
Correct. All right, so I think gathering by the comments, I think we would all be in agreement that we would modify the resolution to provide an additional 10 days.
Up to 20 days.
Up to 20. Yeah, if they're positive again, obviously with,
Do you want to put the condition of the additional 10 to make it 20 with the
As long
booster?
with the vaccine,
With the
they all
third
have to have
shot.
the 3
The third
vaccines.
shot.
okay. Yes, we can do that. Resolution would be changed to up to 20 days, another additional 10 days, having both vaccines and the booster shot. So obviously, there's some intent from the employees. And I think we can say that most of our employees, we have a high number that have been vaccinated.
We're 95%.
95%. So that's something that we want to put out there, that we definitely thank our employees and make it public knowledge that 95%, a little bit over that percentage is vaccinated of.
If I could just add, these are up to so many days, right? So if somebody is positive and they come back before the 10 days, those days get banked for later on. So,
Right.
so they can use up
An
to 20 days. So
incentive for
let's say somebody comes back after 5 days, if they're negative, they still have the additional.
Carry over the other.
That is correct.
That
So-
would be great.
I have a question, though. How do you, and I think it's more of a legal issue, how do you verify if they're vaccinated or not without just their card? Is that?
That's right.
All right.
I think the
You can
part
require-
is the.
Okay,
the
Proof
right,
is fine. You can ask for proof.
Yeah.
okay.
And there's also still exemptions for those with medical or religious exemptions, which I believe the district, we have assisted in the past with forms to that effect.
Okay. That'll work.
So I guess then we could add those people with medical
Exemptions,
issues
yeah.
to add them to qualify for the same thing with the people
They
with
have a
vaccines.
medical exemption?
Right.
The unvaccinated that meet those
Yes.
exemptions. That's fine. All right, that's all move on that.
Second.
All right, so we have a motion by Mr. Montayor, second by Ms. Oliveros, and it's to modify the resolution for a total of 20 days, obviously with vaccines and boosters provided by the employee. So all those, any additional comments? All those in favor?
Aye.
Aye. Okay, all those against? None against? Motion passes. All right, so item B is approval of RFP 082-2021 COVID-19 antigen testing kits.
Mr. Velis, members of the board, Mr. Gonzalez, members of the audience, thank you very much. We are here today presenting an actual bid that we just opened up 2 days ago We took advantage of having this emergency meeting to go ahead and approve it. Just to kind of give you a little history, specifically to UISD, the state rolled out a robust testing program last year. If you remember, we would provide y'all numbers. UISD was the third largest testing entity in the state of Texas. If you could think about all the school districts, we were the third largest. I think we had hit over 100,000 tests conducted in our school system, again, with our employees and with our students. The state has now converted their program. Instead of giving us tests automatically based on a certain percentage of usage, they have now just allocated funds for us to go ahead and purchase through their approved vendors. The problem is those approved vendors don't have stock of the items that we need, which are the antigen Binax tests that we are already trained, already certified to conduct. The biggest thing for us is we want to make sure that these are all self-administered tests. We don't want our employees administering a test onto somebody, right? So we want to make sure that everybody can do it, and we want to do it in masses. We don't want to have to be held back by testing one individual at a time. We want to be able to do 20 to 25, 30 people at a time. So given that factor, even though there is money set aside for us to buy up to $4 million worth of testing kits, they're just not available. That's the bottom line, with the approved vendors that the state provided to us, okay? So that's the caveat. So what we're asking for is we went on our own to go and look out for any other vendors that are out there that have inventory, and so that's what we're asking for approval at this time. Just to let you know, prior to us starting this school year, we were probably the only entity that had about 18,000 test kits. UISD was fortunate that we had prepped ourselves for the start of this school year or the start of this calendar year. And so we were able on Friday to do a robust testing on Friday. We were probably the single largest entity that was testing that many individuals. Every single campus was testing. We had a central location at the SAC where we were bringing in all our substitute teachers. We tested over about 230 individuals. 20-some individuals were positive in that particular event. That actually allowed us to prevent those individuals from coming on campus. So I think we did a fantastic job. The largest entity probably testing at one time, so we did a very good job at doing that. So all those individuals that we have those intake forms, we prevented them from coming on the campus. So that was something that we were really on top of. So what we're asking here today, we did receive a grant, a federal grant, to be able to purchase some items that were COVID related or COVID prevention. One of those is we set aside $400,000 to purchase COVID test kits. So we literally, if the board approves, we would issue a purchase order in an hour from now to purchase up to $400,000 worth of test kits.
There's no restriction to go outside of the vendor list?
No, ma'am. So this is a bid that's local. It's for UISD only. So we can purchase as much. We're not restricted to any funding amount. The state, that amount of money that they set aside, we are restricted to only those vendors that they have approved. We just can't buy any because they don't have any availability.
So we'll buy those when we can?
Yes, ma'am. So
Okay.
this buys us a little gap time.
Right, okay.
So as they get their inventory, we'll start buying from them.
A motion for approval.
Second,
There was a motion,
with discussion, I just have one comment.
right. Go ahead, Mr. Monteverde.
Mike, and I appreciate that. I think the testing is something that's extremely important, and it's probably going to have to happen, every week from here on out.
Yes, sir. And we got information that the federal government is going to start sending tests directly. We don't know the logistics, so we're not going to be holding our breath waiting for them, right? We want to be on top of it and ahead of it.
And that's what I was going to it reminded me of a email I read this morning from Congressman Henry Cuellar's office, where he indicated that there's an expanded testing program from the CDC, and that through this program, CDC was going to provide at no cost these COVID-19 testing kits to child care centers, K through 12 schools and other facilities, and that we can apply directly through his office. And the turnaround was going to be about 48 hours to receive some of these testing kits.
Yes,
so
sir.
I know you talked about the state, but perhaps we can also supplement some of that what you're ordering and what you're going to buy with something from
Yes, sir.
Congressman Cuellar's office. So.
And as of this meeting, we didn't have the logistics on it, so we didn't want to delay our ability to get our hands, because literally the vendors that we are asking for you to approve, They're holding them right now, so as soon as y'all approve them, we're gonna issue the PO. But as soon as we do that, sir, we'll get on the line with Mr. Cuellar. We'll order as much as we
The
can.
more the better.
In addition, there is talk that they're going to be sending test kits directly to the homes, all of us, right? So in a case of mine, we're a family of 4, we're supposed to receive about 32 test kits per family per month. That is the plan. I don't know how they're going to do that logistically, but certainly that is so there's going to be tests coming in. We're just trying to work out the details on the logistics of it.
And that's the point of this whole meeting. We're just trying to buy ourselves some time.
Yes, ma'am.
So that we could be equipped to provide instruction in a safe manner.
Yes, ma'am. And I didn't mean to interrupt, Mr. McMorro, I'm sorry.
No, that's fine.
Yes.
That was you were talking about it, and I just
I
happened to
do
read
have
the
a
email this morning.
question.
Go ahead, Mr. Castillo.
Mr. Garza, what amount of tests do we have available right now on the antigen test? Do you have a number of how many we have
Yes, sir.
still available?
Yes, sir. So I requested that information prior to the meeting. Again, at the beginning of this year, this calendar year, we had 18,000 test kits, which was, again, was the largest amount of any entity in the city of Laredo. We gave out or we're in the process of administering, but we have given out 13,300 tests. We have 4,400 tests available to us right now on hand. As soon as we issue the PO today, we should receive an additional 30,000 tests, probably within the next 2 to 3, no more than a week. So those 4,000 tests that we have will buy us enough time to get those additional 30,000. Once we work out the details with Congressman Cuellar or whatever we need to do, we'll get more tests available to us. And again, we're just,
Will we use the current balance of tests that we have available before we order new ones or before we start using new ones?
I would anticipate, sir, that we would have enough. These 4,400 would buy us enough time to get the 30,000 that we're planning on getting as soon as we place the order today.
I think we need them now.
Yeah.
Yeah, yes.
The vendor could sell them and.
Yeah, so as soon as we issue the PO, he'll send them and deliver them to us. So we're securing that purchase.
That's
Yes.
probably the safest thing that I've implemented in my household, in my office, is testing. You know, you have to know what's going on around you, and everybody should, have that sense of responsibility to test each other.
Yes, sir.
So we don't spread this.
And I want to give a sense of security to the community. We have always been testing. That has not stopped. I mean, even though we have been limited on the number of tests, anybody symptomatic has been being tested at the campuses. We've never stopped testing our extracurricular. That is a mandatory process. That has never stopped. So we've continued that process. There's been talk about in social media about expired tests. The state provided those test kits to us, okay? They have extended those deadlines or those expiration dates. So we're within the parameters of whatever those additional days are required. Here's really, at the end of the day, the biggest thing. If somebody has tested positive, we've encouraged them to retest with a PCR or more advanced test. It's almost a 99% outcome that they have tested positive with another test, right? So even though they show expired on the card, when they go and test again with a PCR, 99% of the time, it's a positive result. So, anybody saying that an expired test is not a good test, that is just on paper it's expired, but the state and the federal government has extended those particular deadlines.
And for our purposes, we're still recognizing that those
Yes,
testing
sir.
kits that we
Yes,
have.
that is correct. Yes, sir. And that's the other thing.
I have another question, one last question, sorry. Mr. Garza or Mr. Gonzalez, when the parents requesting at school, let's say their student, their child tests positive, would they be allowed to take a second one in the next day, or are they sent home with one so they can test at home?
So what we do as a matter of practice, and again, because we're limited on the number of test kits, is that once a positive is a positive, so we recognize it as it being so. We do not recommend testing right away. We usually like for them to wait at least 3 to 5 days to test again, or else we're just never going to stop, be able to, with these particular test kits. So we are erring on the side of caution that if we do have a positive test result, we are sending them home and following our protocols. We do encourage them to go and take an additional test a PCR test, which is a more accurate version of the test. But we are finding out that our antigen tests are confirming the results of a PCR test as well. Okay. And then the other thing, just in closing, we are sticking to the Binex product, which we are already familiar with. We're certified, we're trained. Individuals actually received a certificate in the training. And so the vendors that we are approving today, we're actually approving 5 different vendors so that we have a choice of being able to buy from whoever has inventory. And we're sticking to that particular product, or else we'd have to retrain everybody. And we just don't want to, the time limitations on doing that, it would be very difficult for us.
Okay.
So we are recommending approval of these particular vendors.
Thank you.
Thank you.
Yeah, we have a motion, a second, we already had discussion, so all those in favor for approval? Aye. Aye. All those against? None against, motion passes, thank you, Mr. Ramirez. Thank you, Mr. Ramirez. All right, so we have agenda item 7, it's closed session, time is now 12:52 p.m. Board will adjourn to closed session pursuant to section 551.071 of the Texas Government Code to discuss agenda item 8A. Should be a short,
Very short,
closed
sir.
session, 10
Very
minutes or
short.
less, and we'll be back and reconvene. Thank you very much. Agenda item 8, reconvening from closed session. Time is now 1:21 p.m. The board has reconvened from closed session. And we will discuss item 8A. Mr. Gonzalez?
Yes, sir. Mr. Veliz, members of the board, members of the audience. As you all are aware, COVID-19 numbers have been rising in our community and throughout the state of Texas. This has resulted in a lack of employee being able to report to campuses because of required quarantine and isolation periods. In the interest of the safety of our students, our staff, as well as the challenges available with the lack of available employees, the district will be transitioning to remote instruction beginning Monday, January 17th through Friday, January 21st. This decision is not being made lightly, as we have evaluated all options at our disposal, including the option of shutting down entirely for the week. It is my strong belief that going to remote instruction next week at this time is the best interest for United ISD. Not only will it allow our students to stay home safely, it also provides students the opportunity to continue to receive instruction, which we have been entrusted with. Furthermore, our decreasing staffing levels make this the best decision for our students, as it may become difficult to adequately supervise all classrooms as our staff slowly returns from quarantine or isolation. Still, for those students and parents interested in receiving live instruction, the opportunity will be provided to the district students. Our office will be sending out formal notice to our parents this afternoon and tomorrow with further details of this transition. I ask that we remain calm, informed, obviously safe, and we stay unified. I'm going to ask the board for your support at this time, as this decision is not an easy one to make for our students and our staff. Thank you.
Thank you, Mr. Gonzalez. As superintendent of schools, I know this decision not being taken lightly. I know that you've been in conversation with other district officials, looking
Yes,
at the data that we've seen at the restart of our spring semester. And under your authority, obviously recommending the closure of direct face-to-face instruction, but going into transition to that virtual for next week. I speak for the board. You have our full support for this decision. And for the public, we definitely encourage the continuance of usage of face masks, social distancing. This is something that's temporary, and we're obviously going forward with based on the information data that's out there right now, and trying to limit the exposure and limit the transmission of the flu. So, any other comments?
Sir, I will say, I have to acknowledge that there is no better way to educate our kids than a face-to-face, in-class, on-campus method. However, given the increasing numbers in our community, in our own staff, and administration. I acknowledge that it's also getting to the point where we may not have enough staff to cover the education of our children. And I see around me daily numerous people getting sick, and so I think 1 week virtual remote conferencing will hopefully curb this spike, this surge, and hopefully, if our community I would encourage the community to continue to wear their face masks, to continue to test, to get vaccinated, and hopefully that will help get our kids back on campus. I have constituents who want to stay in school and want their kids in school. I understand that. I do too. However, looking at the numbers, I think it's important that we take a step back and allow some time to heal.
And Mr. Gonzalez, you know, you have my full support. At the end of the day, this is a safety issue. It's about having the appropriate number of staff to supervise our children in the schools. So we gave this a hard, earnest, and sincere effort. We tried very hard, and I want to recognize all the staff for everything you've done. But we've reached a point where there's just too many employees who are out to call it safe. So what we're doing is we're going to take a week. Hopefully, employees that were testing positive will now test negative, and we can come back and be full strength once again. But yes, I recognize that in-person instruction is a way to go, but it's not safe right now.
Thank you, ma'am. Any other comments? Mr. Castillo?
Gonzalez, it's Frank Castillo.
Go ahead.
I lend you my full support regarding this matter. I believe that it is necessary. It's been imposed on us because of the high rate of positive cases in our community. And we stand with our community and we want to do our best. But I also want to call on our families, also be cognizant of what the students are doing and trying to protect them by wearing their masks and doing other things that are necessary, particularly if they are required to be vaccinated. I think we're all in this together, and congratulations to the staff, teachers who have always been there for us to help and mitigate the circumstances that we're in. We are in this together, and Mr. Gonzalez, again, we want to do the best we can to educate our students, and I think right now this is the choice that we have to do, that we have to take. Health and safety of our staff and students paramount to this matter. Thank you.
Thank you.
Thank you, sir. All right, so again, it's not a voting item, it's recommendation that's under Mr. Gonzalez's authority, and as mentioned again, I'll repeat, you have the full support of the Board of Trustees.
Thank you so much. And again, we want to recognize our principals, specifically our teachers, our staff, who, and like Mr. Oliva, we tried this week. It just came to the point where forecasting for next week, we need to make sure we adequately support our campus and our students. I know Dr. Vito Trevino is on the line. He's been in contact with us, both districts, and really making sure that we're safe in the city. I don't know, Mr. Trevino, just so you know that our decision has been made. I know we talked about this yesterday, sir. Thank you for your support as well, Dr. Trevino. May not be there.
All right, so thank you very much. So with that, we'll move on to agenda item 9, it's adjournment. Is there a motion to adjourn? All right, motion and second. Time is 1:29. With that, we adjourn. Thank you very much.
Thank you.